Hi, my name is Dr. Owen Cooper. I am a scientific manager at IQVIA as well as a health psychologist, and today I'm going to present to you two interview studies in wAIHA, which was conducted with sponsorship from Sanofi. The wAIHA fatigue interview study is the first interview that we will go over. Provide evidence of validity for this questionnaire to be used in wAIHA patients. There was no research previously done that indicated that this questionnaire, the passive fatigue, was indeed appropriate to be used in patients with wAIHA. As so, we went ahead and did interviews. This was the objective of the study. And then specifically, the objectives were to understand the patient experience with the condition wAIHA, including the key signs, symptoms, and impacts. We also wanted to understand the appropriateness and value of that questionnaire, which is passive fatigue, in adults in wAIHA by conducting these interviews. And these interviews were one-on-one with adults with wAIHA in the USA, and participants were interviewed by IQVIA interviewers. They recruited through various different recruitment partners, which did include wAIHA Warriors. The interviews were audio recorded, and then from the audio recording, we transcribed it word for word, and then we analysed those transcripts. Regarding the background of the sample, there was 19 patients that were interviewed. The majority of them were female. Regard to level of education, they were well educated, with the majority of them completing a 4-year college degree. Regarding the time since wAIHA diagnosis, the average that they had been diagnosed was 64.9 months, so 65 months, which is around about 5-6 years or so. And then regarding their age, they were on average about 50 years old. The youngest was 23 years old, the oldest was 74. And then regarding the race ethnicity, the majority of the sample was white. We went ahead and did these interviews, and overall the symptoms were shown to be most frequently reported was fatigue, reported by all of the patients. Other frequently reported symptoms included shortness of breath, as well as skin eye color change, as well as headache, dark brown urine, heart palpitation, dizziness. Out of those, we asked what were the most bothersome to them, which was fatigue, tiredness, shortness of breath, and heart palpitations. We wanted to understand which of these were the most important. They were most important if they were reported by the majority of the patients, as well as they indicated that there was high bothersomeness ratings of each of those symptoms. So there were only the fatigue tiredness day to day was shown to be important, salient, and then there was other symptoms as well that were shown to be important, but more so during times at diagnosis, at worst, and flare. When we say important, we mean salient, which means the majority of the patients reported experiencing these symptoms, as well as the majority of them reporting them to be of high bothersomeness rating. Regarding the impacts, there was various different impacts. So there was impacts to emotional functioning, primarily feeling anxious or scared, which was seen by 79% of the patients. In regards to physical functioning, patients indicated difficulty climbing upstairs and reduced physical strength and mobility. And then there was also impacts to activities of daily living, lifestyle, which was needing help from others, which was seen by the majority of the patients. The three most bothersome impacts were seen to be feeling anxious or scared, needing help from others, as well as impact on work and profession. And then there was various important salient impacts, which included feeling anxious or scared and reduced physical strength and mobility, to name some of them. Patients describe different ways to describe their fatigue and tiredness. All 19 of them indicated that they experienced physical fatigue and tiredness. 8 of them reported specifically mental fatigue, mental tiredness, and 13 indicated an impact to their day-to-day life due to their fatigue and tiredness. So even though that it was physical fatigue, all patients experienced physical fatigue. There was different components within fatigue, and that was physical fatigue, mental fatigue, and impact of fatigue. So it's not just simply fatigue, it's physical fatigue, it's mental fatigue, but also the impact of fatigue and tiredness as well. Let's see. This next slide is quite busy. It is quite busy because it lists out all 13 different items. So we have that top row there, which was I feel fatigued. That second item, which is I feel weak all over, down to the bottom item, which was I have to limit my social activity because I am tired. Patients were asked in the questionnaire how much they agree with this statement, but specifically they were asked whether or not that this first they were asked to answer the item, and then after they answered the item they were asked whether or not it was relevant. So overall you can see that from this, with this big green bars for each one, overall the majority of the patients indicated that it was relevant to their wAIHA experience. There was only a small amount of individuals, so 3 for I have energy item, as well as 3 of I am too tired to eat, indicating that it was less relevant to them. We also investigated whether or not the patients interpreted the questionnaire items as it was intended to be interpreted, how the developers intended it to be interpreted. And overall, as you can see here, all of the patients understood all of these items well. As you can see by the green bars here, it was just one patient for item 3, I feel listless, washed out, who did not understand the item. And this was this patient there on the top right. We have a quotation from it which says, I have no idea what this means, referring to the item I feel listless, washed out. I guess maybe burnout. I mean, I get the feeling that they're just trying to go for mental fatigue there. I guess I just feel blah, but it's kind of confusing. I'm not exactly sure what they're looking for. So overall, though, there was just overall 1, and then we had some patients that understood it. It wasn't super clear to them. They understood it a little bit with difficulty. So overall, the patients understood all of the questions in the passive fatigue, the vast majority of them. The conclusions and final recommendations from this interview study indicated that the research identified fatigue, shortness of breath, skin eye color change, headache, heart palpitations, and dizziness as important salient signs and symptoms of wAIHA, but fatigue was seen to be the main symptom that patients experienced, with physical fatigue being more common, specifically within those different components of fatigue and tiredness. And this was impactful and important to more important to patients than mental fatigue. The research feeling anxious showed that feeling anxious or scared reduced physical strength and mobility, difficulty climbing upstairs, feeling of anger or frustration, needing help from others, feeling worrisome, and impact on social activities were seen to be salient because they were reported by the majority of the patients in the interviews, as well as bothersome to them. And overall, the conclusion of the interview study was that the questionnaires, the FACIT fatigue, PGIS fatigue, PGIC fatigue, which were the two small scales on the end of it, were relevant, clear, and easy to understand for most patients. So this study therefore provides evidence of content validity for use of the FACIT fatigue in measuring fatigue outcomes for adults with wAIHA. And overall, that the instruments have strong evidence of validity. One of the main symptoms that was seen in these interviews was shortness of breath. And from this, we did this first interview study, and then moving on to the second interview study, we wanted to focus more on this experience of shortness of breath because it was seen, reported by many of the patients in this first interview study. So we wanted to focus more on this in another interview study, and this was called the wAIHA dyspnea interview study. The objectives of this study was to understand the patient experience with wAIHA-related dyspnea, aka shortness of breath, and to identify the most bothersome impacts of dyspnea, so how that impacts their day-to-day lives on a daily basis, but also to develop an illustrated model in adult wAIHA patients to show what it is like having the condition, and specifically for dyspnea. We also wanted to understand the appropriateness and value of a questionnaire. This questionnaire is called the FACIT dyspnea. So the first questionnaire that we looked at in the first interview study was called the FACIT fatigue. This is called the FACIT dyspnea in adults with wAIHA by conducting interviews. Again, these were one-on-one telephone interviews with patients recruited by different recruitment partners in the US, which included wAIHA warriors. Those interviews were, of course, audio recorded with the word-for-word transcripts analysed afterwards. Overall, the interviews lasted approximately 90 minutes. The first 35 minutes or so were seen to focus on what dyspnea symptoms do patients experience day to day, but also how they impact them day to day. And then we looked into the questionnaire feedback. So are the questions understandable of the questionnaires? And then again, we looked at two scales, which is the PGIS and PGIC dyspnea, which are just two small scales specifically on dyspnea, aka shortness of breath, and wanted to focus on, are these questions understandable? Are they relevant to individuals with wAIHA? 15 patients were interviewed in this study. We can see here that, again, this majority female, 12 of them are female. Overall, there was seen to be 13 of the patients diagnosed within the last 6 years, 8 specifically with the last 3. The age at time of consent of these interviews was 54 years old, the youngest being 35, the oldest being 74. Again, race, ethnicity, the majority of them were white. There was various different ranges of education from high school, some college and associate degree, and regarding employment status, the majority of them were working. Regarding the patients described different aspects of their dyspnea, including how they regularly experience this alongside fatigue. So 12 patients spontaneously, when we say spontaneously, they indicated that they experienced dyspnea alongside fatigue without us asking. They spontaneously reported that in interviews, that these symptoms occur in a feedback loop. The effective hemoglobin levels, so when the hemoglobin levels are low, they experience greater symptoms. This was expressed by the patients in the interviews. Specifically, when their hemoglobin levels are low, they experience dyspnea, fatigue, and dizziness. Patients also explained on different ways that methods to alleviate and prevent their dyspnea, which include simply by resting, so self-management, taking deep breaths, avoiding physical activities, but also medicines including prednisone or inhalers. Here we have an overview regarding the impacts to life due to their dyspnea. Vast majority of them indicated difficulty walking, which is 93%. Difficulty with instrumental activities. So when we say instrumental activities, these are activities such as putting together a shopping list, going to the grocery store, bringing the groceries back home and cooking them. That is what we would describe as instrumental activities. It's the day-to-day activities that are a bit further than basic activities. So basic activities would be being able to wash yourself and go to the toilet and be able to eat food by yourself. That's what we would indicate by basic ADLs, activities of daily living. You can see, which is 60% of the patients indicated that as an impact. Other important impacts include difficulty climbing upstairs, needing frequent breaks, as well as difficulty with or avoiding physical activities. To them. As an individual with wAIHA, these items in the questionnaire called the facet dyspnea. Here again, we have some more items, again, follow-on items, and the majority of them, again, was seen that these items were relevant. So the questionnaire was relevant to them as an individual with wAIHA to use this questionnaire, the facet dyspnea. And in regards to comprehension, the vast majority of the patients understood all of these items as they were intended. Just with sweeping or mopping, there was a couple of the patients that didn't understand it as well as the developers intended, so the questionnaire developers intended. So for example, 2 patients interpret sweeping or mopping to mean vacuuming. I look at sweeping as vacuuming, this one patient indicated.
Thank you, Owen. So, hi, my name's Kate Burrows, and I lead clinical outcome assessment work at Sanofi. So, in simple terms, that means that my role focuses on making sure that what we measure in our clinical trials truly reflects what matters most to patients. So, building on the qualitative research that was just presented, I'd like to show a bit more how the wAIHA community's participation in those interviews has led to real tangible changes, both in how we design our clinical trials and also our broader understanding of the disease. So the impact of the wAIHA community's voice. So on this slide, you can see how the patient voice sits at the center of everything we do. Each part of this diagram shows a different way patient input directly influences what we do, from how we design clinical trials to what we choose to measure, and to how we share the results with clinicians and the broader research community. So what this diagram really illustrates is that patient input isn't just a box we tick, but it informs our decisions from the very start and has multiple, wide-reaching impacts. Over the next few slides, I'll walk through each of these areas in more detail, starting with why the community's voice matters, what patients told us, and how that translated into real measurable changes in our wAIHA clinical trials. So why the community voices matter. So historically, the patient experience of wAIHA hasn't always been fully reflected in clinical research, and much of what we have known about the disease has come from clinicians and lab results such as hemoglobin levels, rather than from patients describing how the disease affects their daily lives. But in a rare disease like wAIHA, every single patient voice matters, and the patient input that we obtain ensures that our research reflects the holistic picture, not only what clinicians observe or what lab tests measure. So, put very simply, we couldn't build a complete picture of wAIHA without hearing directly from the people who live with it every day. So this slide here brings two important pieces together. On the left are direct quotes from the patient interviews, and on the right is how those insights from the patients translated into what we now measure in our clinical trials. And what came through consistently and what was covered previously by Owen were two dominant symptoms, fatigue and shortness of breath. Patients described fatigue that made even simple daily tasks feel overwhelming, such as cooking, laundry, or getting through a workday. And shortness of breath wasn't described during exercise alone, but even during everyday activities such as walking from one room to another. And these weren't isolated accounts. When we analysed the interview data, every single participant described fatigue, and almost all patients described shortness of breath. They were also reported as the most bothersome and impactful symptoms, and because of this strong and consistent feedback, we made the decision to include patient-reported measures of fatigue and breathlessness as key endpoints in our clinical trials. So in other words, we are now directly measuring the symptoms that patients told us matter the most. So ensuring meaningful measurement. So once we identified fatigue and shortness of breath as the symptoms that mattered the most, the next step was to make sure we were measuring them in the right way. We selected two well-established instruments, the FACIT fatigue and the FACIT dyspnea, which are both widely used tools in clinical research to measure fatigue and shortness of breath. We needed to then check whether the questionnaires we planned to use in our trials truly reflected patients' experiences, using language that felt clear and relevant and without being too long or burdensome for patients to complete. And based on the patient feedback we received, we confirmed that these measures were suitable for use in our wAIHA trials. So how community feedback shaped our trials. So this slide summarizes the direct connection between patient input and our clinical trial design. First, what we heard. In the interviews, fatigue and breathlessness clearly stood out as the most common and most impactful symptoms affecting quality of life. Second, what we did. We incorporated patient-reported measures of these symptoms directly into our clinical trial design. In other words, we made fatigue and breathlessness a formal part of what we measure when evaluating a treatment. And third, how it helped. Clinical trial participants are asked about their fatigue and breathlessness using validated questionnaires, and these responses form part of how we assess whether a treatment is truly making a difference. And so the key takeaway here is that this patient input didn't just inform our thinking, it changed what we chose to measure and prioritize in our trials. So raising awareness of the patient experience. So following the patient interviews, we've shared the findings from this research in several ways, including poster presentations at scientific conferences and publications in peer-reviewed journals, with additional papers currently in development. This serves several purposes. Firstly, it contributes to the published evidence base on the patient experience of wAIHA, which has historically been limited. Secondly, it helps educate clinicians, researchers, and regulatory agencies, including the FDA, about the symptom burden and the quality of life impacts that patients face. Importantly, symptoms like fatigue and breathlessness, which patients consistently identified as central to their experience, are now gaining broader recognition within the medical and research communities as clinically meaningful aspects of wAIHA that warrant systematic assessment. So, impact on future research and patients. So this research has created a foundation that future wAIHA studies can build upon. Future clinical trials in this space can begin with a clearer, evidence-based understanding of patient priorities rather than starting from scratch. Importantly, symptoms like breathlessness, which were previously not captured systematically in wAIHA clinical research, can now be assessed more consistently using measures that have been evaluated specifically in this population. This progress was made possible by the patients who participated in our research. On behalf of Sanofi, I want to sincerely thank the wAIHA warrior community for your participation and continued engagement. Thank you.